Okay, so TJ Watt underwent surgery for partially collapsed lung caused by dry needling, as posted here by people. His brother JJ also confirmed that on X. And so let's get into it. Now, my name is Dr. Brian Ladd. I'm a physical therapist. I'm residency trained, board certified. Spent my first 5 years as a physical therapist in the United States Navy, and the last 6 years owning my own private practice here in Des Moines. Now, dry needling is something we use all the time in physical therapy. You'll see other professionals use it as well. And by and large, it's a very safe modality. But it is a needle and we are sticking it in someone's body, so that makes it a little bit invasive. Now, obviously, some parts of the body are safer than others. Over the lung field, not very safe. There are safe ways to go about it, and it really depends on your level of training and your comfortability in performing that. With that said, though, some people who are trained in it and feel very comfortable with it make mistakes. So, as you can see here, dry needling can be very dangerous, and things can happen. Now, some of you may be asking, what is dry needling? Well, dry needling, as we like to say, is Western acupuncture. So, acupuncturists, don't get at me for this, but essentially, we are using an acupuncture needle, and instead of following meridians and chi like acupuncturists will, this technique's a little bit more direct. So, say your back hurts, we're going to stick needles right in your back. And I'm sure acupuncturists have a similar technique. I don't know. I'm not certified to do that. I am certified to do dry needling, and so I'm speaking from my experience there. And we could get into the research and the benefits of dry needling, whether it works or not. That's a different video. I'm not going to get into that today. It can be very effective for pain. Obviously, an NFL athlete is using it. Must be pretty helpful. Now, a collapsed lung, pneumothorax. This is something that's in our consent forms we talk to people about, especially if we're going to be anywhere near it. You've got to inform them of the risks, right? And so with a collapsed lung from the dry needling, a pneumothorax can be caused from many different things. Usually it's some sort of trauma. In this case, the needle actually punctures the lung. You stab the lung with the needle, and it can cause that to collapse. Now, typically, it's only one lobe or one area of the lung, not generally the whole thing from dry needling anyways. And oftentimes it can kind of spontaneously heal itself and people are fine. But in other cases, people need surgery to assist with that. And that's what happened here with TJ. So dry needling can be very dangerous. It can also be very beneficial. There's pros and cons to everything, right? And you've got to weigh the pros and cons. And as a provider, you need to get informed consent and let people know of the risks and what can happen with that. So let me know if you got any questions. I'd be happy to answer any questions you might have about dry needling, about pneumothorax. Fortunately, this has never happened to me or any of my patients, I should say. But I'm overly cautious, and that's something my training in the military taught me to be very, very cautious with this, and it scares the crap out of me, honestly. So let me know if you got any questions. I'm happy to answer them.